Hi guys, this is Meg again. We have moved on to hemostasis and coagulation. Hemostasis being the maintenance of circulating blood in the liquid state. It's basically stopping the flow of blood, and coagulation is when the blood clots itself. Once again, hemostasis is the maintenance of circulating blood in the liquid state and the retention of blood in the vascular system by preventing blood loss. It's stopping the flow of blood. Coagulation issues that affect phlebotomy would be drugs like heparin and Coumadin, which suppress clotting and may result in patient bleeding more than normal. So you always want to know if your patient is taking heparin or Coumadin because they will bleed a little bit longer than normal patients. Vasoconstriction is a rapid constriction of the vessels to decrease blood flow to the injured area. It's when basically the veins or the arteries, basically the veins, shrink in size so that they can slow the amount of blood flow. The body does this automatically when you're injured so that you don't bleed out. Platelet plug formation is when platelets degranulate, mesh together, and stick to injured vessels to form a plug and stop bleeding. It's part of the coagulation process. Secondary hemostasis is when the fibrin clots form. Coagulation factors are released and interact to form a blood clot. It seals off the damaged portion of the vessel so you no longer bleed. It normally probably takes about 5 minutes for this to happen. There are different pathways which are not necessarily needed to know for what you're doing. Just know that there are common pathways: an intrinsic, an extrinsic, and a hemostatic plug. Fibrinolysis is final regeneration and repair of injured vessels. The clot slowly begins to dissolve while the other cells continue to repair. So once the clot begins to dissolve, that means that the wherever the bleeding is taking place or wherever the skin is injured, that means it is no longer bleeding, so the clot can dissolve. These are just some steps of hemostasis. It's a vascular spasm, or when your vessel's injured. When the platelets get together to make a plug, it's like forms kind of a barrier so that you can't bleed out anymore. And then fibrin, your blood clots with fibrin, and the skin or wherever is wherever the injury is takes over and repairs itself. So this is the coagulation slide. Damaged blood vessel shows a damaged blood vessel, formation of the platelet plug, and development of the clot. So it's just one more way of looking at it.